Good afternoon. My name is Kashonda and I am an infusion nurse. On a normal day as an infusion nurse, it kind of just depends on my assignment. Sometimes I have one client that's a very long infusion. Sometimes I have a couple clients that are shorter infusions, and sometimes I just have a short day. Today is one of those short days. So I will talk to you about what I've already done so far, and then we're gonna head to my second client of the day, which is a very quick visit. A lot of times, at least with my company as an infusion nurse, I usually end up knowing my clients. I definitely have weeks where I meet new patients or I do new SOCs, which is a start of care. But this week, everybody that I'm seeing, I already know. So the first client that I had today was a shorter infusion. They do get pre-hydration medications, which is normal with IVIG, which is what my company specializes in. I could talk more about that in a different video, about what IVIG does, what it's used for, all of the things. But this morning I had one client that was receiving IVIG, which means that I place a line, or if they have a port, I access the port. And then I go ahead and mix up the IG in the home setting. If they have pre-medications, usually it would be like a Tylenol or Benadryl, Claritin, different types of antihistamines or Tylenol, because a lot of times when we're giving patients IG, they'll end up with a headache just because your body is kind of like accepting that extra volume, and sometimes it just affects you in that way. So I do this in the home care setting, so the orders are very specific. I can only do what I'm ordered for. If it's not ordered, then I'm not doing it. If I have any questions about anything like that, I have to immediately call pharmacy, and then they give me the guidance that they're comfortable with. And then as the nurse in the home care setting, I make sure to write a note about it. This morning was easy peasy. We got access very quickly, which is normal because this client has good veins. I make sure to go through my nursing assessment, make sure there's no changes, no recent hospital admissions, no illness, full body assessment. I'm listening to lungs to make sure that there's not a bunch of extra fluid sitting on them, because if somebody's holding on to fluid and they're not filtering it correctly, the last thing you want to do is push more fluid on them. And then just monitoring vital signs, primarily heart rate and blood pressure, just to make sure that they're not ending up in a hypertensive crisis, or that they're not hypotensive and having another issue going on. So first visit went well. My next client is actually not far from here at all, and it's a very quick visit. It is going to be sub-Q IG. So sub-Q IG is just as it sounds. It's subcutaneous. So we use fatty tissue, usually the stomach. You can also do thighs or arms, depending on what the client prefers. And it is a very quick infusion. It's literally under an hour. So what I'll do is the charting that I didn't finish from this visit, I'll do that while they're getting their infusion. And our notes are due within 24 hours. So if for some reason I can't finish my note during the visit, I will just finish it tomorrow on my shift, or depending on how my hours are looking, I'll just like write it for documentation time and then charge for that. So let's get to the next visit. It is about 12:45. I told the family I'd be there between 12 and 1, and it looks like I'll be there right at about 1 o'clock to get things going. So I'll see you after the next visit. Hi guys, welcome back again. So I just finished my second client of the day. It's somebody that I did a start of care with recently, so I do know them, I know the family. It's a very quick visit. Sub-Q IG normally can be extremely quick, from about 15 minutes. The longest sub-Q IG I've done has been like an hour and 5 minutes, and this one was exactly 1 hour. So the process is pretty easy. You literally just cleanse the area depending on the amount of sites that the needle set comes with. And then once you cleanse the site, you allow for it to dry so that the alcohol actually does its job and cleans the area. And then depending on the order, there will be a specific gauge sub-Q needle, and you just insert it straight in, and then you secure it with a dressing. Different types of pumps. So this pump I'm used to using. I was in and out of there literally within an hour and a half, which is cool. So the rest of my week is like, some days are slower, and then I have a couple longer days towards the end of the week. So it all ends up evening it out for my hours. I am actually a 30-hour employee, which I'm actually happy about because I can pick up and flex up to 40 hours. But what I've noticed is with different types of companies, what they do is they'll go through phases where they'll have a certain amount of nurses, and then they'll have like a lull where they lose some nurses, and then they'll hire a bunch of nurses, and then they'll have to be able to spread around the hours, which is something that I don't really prefer, because if I'm hired for a certain amount of hours, I expect that that's the hours that I got hired for. So I'm actually glad that I didn't get get hired for 40 hours, because the amount of times I've been like tagged in emails from the team or got text messages from my coworkers who are 40-hour employees and they're complaining that their hours are short is outrageous. So I'm actually happy that I'm a 30-hour hire, because it gives me the availability to have another job, pick up per diem somewhere else, or if they're short and need it, they'll text me and say, hey, can you take this client today? And then I'll decide like yes or no, because technically if my assignment is already set up for my 30 hours, they have to ask me if I want to take somebody else on my schedule. So I kind of have that freedom to pick up as I prefer. Before I came over to Infusion Nursing, I was a travel nurse. I would do local contracts and I would do like 312s a week, emergency department nursing. And then I started getting spoiled when I decided to take a break from the ER, and I did some outpatient things that were kind of like behind the scenes. Like I had like a desk job where I was doing a lot of care planning and I was working with a specific pediatric demographic. And then after that, I kind of was like, I don't think I want to go back to running around in the ER, which is totally fine. Like if that's what you love, do it. I loved being in the ER. Sorry, my camera keeps trying to focus and I'm not even holding a product to focus on, but we're gonna go with it. This video is getting uploaded like this. But I have a lot of different backgrounds, so like if you're curious about that, let me know. I can do a dedicated video to that. But this little series is just gonna be like work vlog vibes, infusion nurse vibes. So any questions you have about it, comment down below. I can say that like I don't think that I could ever just do strictly home care nursing with, like, you guys know what home care nursing is. Like if you know, you know. I am specifically and only doing infusions in the home care settings. I'm either doing sub-Q infusions, or I am doing IV infusions, or I am accessing ports and doing infusions through the ports. Do hydration. We primarily infuse IVIG or sub-Q IG like I just talked about. We do take on acute patients as well that need like PICC line treatment, dressing changes, antibiotics for a short term at home until we can teach them to do it independently. So that's kind of what I do as an infusion nurse. I don't do regular med administration, bathing, wound care. That's not my niche. I have a lot of respect for home care nurses who do that, but that's just not what I do. And yeah, so easy shift today. I had planned to hit the gym today, but I'm still not feeling 100%, just like a little congested. I don't have fevers. I'm not contagious or anything right now, but the thought of like lifting right now and being on the treadmill, like I won't make it through. I'm just gonna like go home, nurse content to come. I know that if you've been on my channel, you've seen that I do a lot of gym content. That's really my vibe. I love the gym. I'm always in the gym. So the fact that I had to take the past, pretty much, I think it's been like 4 or 5 days since I've been to the gym. It is what it is. You got to take care of yourself or you can't get better. Thank you so much for watching. I really appreciate it. Let me know what nurse related content you guys are interested in seeing. As always, more life, more blessings. Bye.